All right, put a reminder in for myself to get this going, so I apologize for that. This webinar is being recorded. We'll be hosting this on the USA Cycling website. Again, due to the size of the meeting, we've limited the chat functionality. All questions being submitted on chat will be consolidated and answered in a FAQ. And we have posted the documents we're going to reference on the USA Cycling website. We'll talk about updating those and how we're going to handle those. And also, just please remember to mute your computer so I don't have to go through and do it for you. Right now, I'm going to hand it over. I believe he's on, Rob DeMartini, our CEO, for a few words. So, Rob, if you're on, you should be able to unmute yourself, and I'll turn it over to you.
Chuck, thank you, and thank you everybody for joining this. It's not lost on me. Some of you I've met, many of you I haven't. I've been with the organization about a year, and like you are dealing with, unprecedented disruption to our business model, starting in early March, and continuing through now and for some time to come, and also prolonged amount of uncertainty. You've got uncertainty at your workplace, you've got uncertainty in your home life, you've got uncertainty in almost every hobby that somebody's involved in today. So we recognize that. As Chuck said, our staff's been remote for 9 weeks now. And quite frankly, I tell you, I've never seen them work harder. The financial implications that hit us quickly, we took some actions on. We've got some actions left to take. But regardless, we're here, and the team is working very hard to try to do what we can for the sport. And in that case, what that means is trying to bring riding and racing back safely and under the best possible conditions, given what we're dealing with. I think what you'll see here is the body of work that Chuck and his team are going to share is, number one, an extremely high quality effort that's been pulled from resources from many different places. And I've seen the product in its current shape for about 4 or 5 days now, and I'm incredibly impressed with the work they've done. It's not only high quality, it's driven by passion. The people that work at USA Cycling and that support our efforts, from volunteers to coaches to officials to members, love this sport, however they engage in it. And us making this available to you, I see very much in the scope of the work that the national governing body should do. It's also been made available to everybody in the sport, whether you're a member or not. Obviously, your membership helps us get this done, but we think this is important enough that it's going to everybody. And that's really how we're going to try to run the governing body going forward, that when we have high quality work that can serve the sport of cycling, we're going to make it available as broadly as we can. So thank you for committing to join us this morning or this afternoon. And Chuck, I'll hand it back. And again, my thanks to you and your team. I think this work is outstanding.
Great, thanks, Rob. And I'm now going to turn it over to Tara McCarthy. Tara is our Director of National Events. As a lot of you know, we did recently a survey. I think we had, Tara will give you the number, but a ton of responses for that. We were asking some very basic questions to our membership and others in regards to what their motivations were, what their concerns were with racing and riding in the coming years. So Tara, I'm going to turn it over to you.
Great, thanks, Chuck. So as Chuck said, we really appreciate all of those who completed the survey, and for those of you that sent the survey link out to your email list. We're really happy with the number of respondents that we did receive. And Chuck, if you can just open up that first slide for me. And so the survey did run May 8th through 17th, and the breakdown between male and female is pretty similar to what USA Cycling's membership is. And so we had 79% males respond and 20% females respond. And we did ask what people's primary bike they rode. And so 62% responded road, 19% mountain bike, 11% cross, 5% gravel, and 3% track. Now, we didn't ask whether they rode competitively or non-competitively. We just asked what bike they primarily rode. And here you can see that for respondents with events on their 2020 calendar, there's a high percentage that are going to continue to compete in those events. And 72% said yes for the males and 59% for the females. And in addition to this question, we also asked whether people would participate in events not planned for this year, so not in their initial calendar. And a combined 55% for females and males did respond that they would participate in events not in their initial plans for this year. A smaller percentage at 32% said that they were unsure at this point in time. And Chuck, if you can move to the next slide, please. So here we did ask respondents at what level they plan on participating once events are up and running and authorized by their local jurisdictions. And this isn't really much of a surprise. As you can see, 76% said that they would participate locally, followed by regionally, followed by nationally, and then 9% were unsure. Again, this doesn't come as a surprise, as we've seen travel disrupted during the pandemic. As you can imagine, people probably are pretty unsure and fearful of unsanitary situations, whether that's flying somewhere by plane, driving, having to go to the gas station, stay in hotels, etc. And this actually trends fairly similarly to a separate survey that a different organization did. They actually polled parents for youth members of recreational sports. And so 82% of those parents said that they would allow their kids to participate within a 3-hour drive from their homes. And they also asked whether that would change as time went on. And when they got to September, that window of distance that they would travel for an event actually increased. So really similar information across the board and outside of our sport. And now there was a minor difference here between men and women. Women actually reported that they would participate slightly more on the national side of things than the men. Now, with all of that said, we did have a percentage over 50%, so between men and women, that said that they would participate less than they have in the past. And we know that events have been canceled during the front half of this year. And so if someone had potentially six events in their plans for this year, that might drop down to 4. We're not 100% sure. So even though people are willing to participate, there is a percentage that are going to participate less this year. Now, along with this breakdown in how far people would travel to participate, there is a difference between the size of event that people would participate in. And so 38% of males and females said that they would feel comfortable participating at an event of 250 plus participants. And then the next most selected response was 100-person max field, and that was at 16%. And Chuck, if you can move to the next slide, please. All right, so here we asked folks what the financial implications for COVID-19 would be. And 78% of the respondents said that the financial impact would not prevent them from participating in events this year. 6% did indicate that there would be a long-term financial impact. And as the situation changes, as the economy changes, this metric could absolutely change over the next coming months. And going back to that youth survey, very similarly, 50% of their respondents said that today's market challenges would not impact their sports travel budgets. So this is fairly good news. And now we did ask how much people plan to spend on the following categories. And the majority said that they would spend the same across registration, travel, lodging, and merchandise. What's super interesting here is that red portion of this. That is the more spend. So very few people will spend more over these 4 categories than they typically would. And I think that's important because as event organizers, we may see some increases in our expenses as we navigate safety precautions, staffing, etc. And so there may not be appetite for an increased participation fee at events. And Chuck, if you can move to that last slide for me. And so here, this one is super important and interesting to me and probably to all the event organizers on. We did ask how comfortable they would feel registering for an event and how far in advance. The majority said 2 weeks prior to an event, followed by 1 week, followed by 1 month. And this is something that makes me nervous as we internally take a look at registered riders lists before our national championships, not really knowing how many participants would be at my event until 2 weeks prior does make me nervous. So this one I found was super interesting. And now just over 50% of the respondents for the survey said that they would feel comfortable with a no refund or limited refund policy if an event was canceled. And now I just had a couple of slides here today so we can move on to the doctor's portion. And so just overall, people are definitely interested in participating in events still, potentially some less than in the past, but financially they feel that they can still spend the same and they're going to do so more locally than nationally. And we do have, as Chuck mentioned, some overall survey results on our COVID best practices page. And we're actually going to do a deeper dive into the survey results to get some discipline specific information out to you guys. And I'm definitely over my time, so I'll turn it back over to you, Chuck. Thanks.
Great, thanks, Tara. And as Tara noted on there, she gave a lot of numbers out. We are going to make this available on our website, so you'll be able to go to that resource page we mentioned and pull these down. The crew, I think we ended this Sunday, and they've really been crunching numbers and producing graphs pretty much nonstop since then. So we'll plan on getting those updated and try to add even more information, have those available. I'm now going to talk a little bit about our return to riding and racing guidance documents, and this is really what we've been working on. Just going to go through my notes here and cover a couple items, so pardon me if I'm not looking directly at you through Zoom here. First, this is really a snapshot of best practices with the current phase of the virus. This will be reassessed as we learn more. I think all of us can agree that what we had planned 6 or 8 weeks ago is far gone right now. And you have our commitment. We're going to continue to reassess and update these documents. Importantly, no one has all the answers, even us. But we felt it was important to start a dialogue and offer suggestions and solutions for the community. There are several items we won't be addressing on the call today as it pertains to event organizers. As an example, at this point in talking to our medical consultants, we don't feel like we can offer any guidance on testing of participants at events. That's something that may change in the coming months. We're looking at, and as we know more and society knows more, we'll look to provide guidance on those items. Also want to point out, we see in society in general, it doesn't matter if you think COVID-19 is serious or not. We're all having to respond to restrictions and market pressures out there. Whether you think there's no risk or you've stayed in your house for 8 weeks and haven't left, we all have to respond to what's going on in the world, for better or worse. I'd also ask and say that we need to be respectful of other people's viewpoints and concerns. Whether you're working with them or whether you're hosting an event, you need to understand other people's concerns about attending or not attending. So USA Cycling's ban on permits, which we put into place several weeks ago, is going to expire on May 31st. We are accepting permit submissions and applications for after that date. We received a couple questions via email on timing and late fees, and I want to address those now for the organizers. First, we'd prefer, the question was whether we waive late fees. We'd really prefer you go ahead and submit an application so nobody's rushed. And if it comes down to your event being canceled, we will waive those permit fees and refund them to you back. So there shouldn't be a concern there. There are a few charges we need to do. For instance, for the organizers who have done this, there are insurance certificates that you provide. That's actually a hard cost to us that we pay for when we acquire those. So unfortunately, we don't get refunded on those. That's a relatively small cost. But we will be refunding any permit fees for your events if you submit and later have to cancel. Please don't get us permit applications 3 days before your events. That causes issues for us and for you. We've also had some questions about insurance and liability. It's obviously something we've talked to our insurance carrier and legal department about. USA Cycling's insurance policy generally covers bodily injury. This includes injury, sickness, or disease. If someone makes a claim they contracted COVID-19 in an event, the policy will respond under the duty to defend. Whether the policy would pay damages, just like any claim for any instance out there, is going to be dependent on the facts and circumstances of that actual claim. I'd also ask if you're an organizer, and this has always been the case, remember a USA Cycling permit is invalid if you're in violation of local laws or regulations. This also negates your insurance coverage. You have to have all your permits and permissions and be in compliance with any requirements to hold your event under USAC sanction. Don't break the law and the permit will be in effect. Make sure, and we'll talk about this in a bit, that you are following all those local guidelines because that permit does depend on it. I'm going to start running through some slides. We created this graphic and you'll find it. The challenges we face right now as a sport are pretty massive, and as a society. There's a huge array of information, advice and opinion on threats and solutions, some of which is contradictory. There's also a patchwork of guidelines and regulations throughout the country, some of it contradictory. You can see from this slide that there are many different organizations the event organizer must work with. A lot of you have heard in the news about reopening and what's happening in different states. You can just see here the number of entities that our organizers have to work with. What's really important and different on this slide, and we point this out in our guidance documents, one group that many organizers rarely work with is the departments of health at the local, or regional, or state level. And they will be hugely important, as we point out, for you to contact and make sure you're in compliance with as we move forward. What has become clear is no one is going to swoop in and save the sport of cycling except for us. And by us, we don't mean USA Cycling, we mean the whole community. It's up to all of us, and we're going to welcome your input on these documents as we move forward. As I mentioned earlier, we're providing these not as the magic beans that are going to solve the issues, but as a starting point to move forward and get back to the sport we love. So I'm going to walk through some of the documents we've created here. The first tool that is available, and we've shared this with several of our organizers, this is just a very small portion of it, is a multi-tiered risk assessment tool for events. And what we saw talking to our stakeholders is there's really 3 buckets of risk that events need to consider. I think first and foremost we can all identify is the safety risk. So we've basically prepared some questions, and we've taken a lot of this information from the WHO's risk assessment documents to basically ask how prepared is your event and how can you prepare better. Within those questions, we've got links that basically reference what the question is and provide the organizer with some background and some help. And you fill that out and gives you a score here. This is the final dashboard out of that risk assessment. The second is what we're calling social perception. And this basically looks at how your event will be seen if it operates. Although it is lessening, there's still quite a demand for personal protective equipment in a lot of areas. Testing, while available in a lot of areas, is limited in others. And if you're holding an event in the community and are using a lot of the protective equipment as an example for your volunteers or staff or participants, and the hospital down the road can't get it, what does that make your event look like? Something that we are looking at, quite frankly, with our national championships is taking relatively large events into very small communities that may not have the hospital beds in place if we don't even have a COVID issue, but have some crashes and other things. Are we taking up valuable hospital beds? And is that health system ready to handle both the local issues and what can be brought in? So this is a bit of a snapshot of how your event is going to be received as an organizer in the community and in general. Finally, like it or not, we have to look at the financial considerations with events right now. We know that a lot of races, most, run on very, very tight margins. Tara referenced the question about refunds of the entry fees. We know as organizers we have a lot of upfront costs and the ability to cover those, but also, what will happen with your normal participation. And from the slides Tara showed, like it or not, we're probably going to see a decrease in participation, whether that's based on people's finances, fears, lack of ability to travel, family commitments, anything else. Likewise, as you'll see if you go through the documents, there will likely be an increase in cost for many events. Things like providing protective equipment, hand wash stations, hand sanitizer, possibly additional signage. These are things that need to be considered for events, and we wanted to contribute to that thought process. This is an open document and is available for anyone. It's not something that is being turned back into us. It's something for events to use as they assess their event and move forward. The second, which again is available on the website, it should be up now, is our Return to Erotic and Racing Toolkit, and this is meant for organizers. This is a guidance document, and what the challenge for us is we have a huge variety of events and disciplines. We permit over 2,000 events of all types per year, and that's just a portion of total cycling events. There's really no one-size-fits-all available. We have everything from BMX freestyle with 20 people to grand fondos with many thousands of folks in them. As we shared this with members of our community, I just want to make it clear, this is a list of suggestions, and it's not expected any organizer does every single thing in here. What we've done is taken a collection of existing tools from the CDC, WHO, and other entities, and we've applied those to cycling. This is something that was really missing. Just today, just a few hours ago, we saw our first really good state-issued guidance that had anything to do with cycling. It was from Massachusetts and dealt with mountain biking. That's certainly something we'll integrate into this. You're going to see a lot of references in this document to publicly available guidance, and these are in specific areas that might help you as an organizer. The main goal of this tool is to offer suggestions and tools to make the event safer and assist with helping you gain permission from those local entities. We know this document is just a start, and we're looking forward to improving and updating that as we go through. And again, this is available for everybody. Cycling, USA cycling events, non-USA cycling events, and any others out there. Again, this also covers general event production and goes into some specific disciplines. All these are available right now, and I'm going to show you a couple of just pages from the document. What we've tried to do is take a look at things like packet pickup for an event. How do you modify packet pickup to recognize social distancing? We look into specific event considerations such as time trials. That's one example. How do you reorganize the start of a time trial in order to make it safer and respect social distancing? Earlier this morning, I talked to the sergeant from the Colorado State Patrol, who's a friend of mine I've worked with for years. This is the person who's in charge of approving events for almost any cycling event in Colorado, especially those on state roads, and he's got vast experience with our sport. In talking to him and other stakeholders like him, he wants and is expecting events to come to him now with solutions. He's not going to educate the event on what to do and what not to do. What he is looking for is an organizer to come to him with a plan to help mitigate the safety risk and show that they care about producing a good event. I shared these tools with him, and he thinks things like this are a really vital part in events happening in the future. That if he, as an example, sees an organizer come and implements the CDC, WHO, state and local guidelines, that it gives him a sense of confidence that the event will be run safely. That's really what we're looking for on this, is to assist organizers in assessing the risk, making a determination on whether to have their event or not, and provide resources to make that event safer. And as part of that, to enable events that are able to happen to work with the local jurisdictions to get permission. So we hope that you find these documents valuable. And again, we really are looking forward to getting feedback and improving these. This is a start, and we see a lot of changes coming over the next few months with this. So now I'm going to turn this over to Kelsey Erickson. Kelsey works with us at USA Cycling. She's going to facilitate the Q&A with our two doctors, Dr. Roshon and Finnof. I really want to thank them, number one, for their guidance, and two, for taking the time today away from their very busy schedules right now, and talk a little about where we are with the pandemic and answer some questions. So Kelsey, I will turn it over to you.
Thank you very much, Chuck. I am grateful for this opportunity and super thankful to have both Dr. Finnof and Dr. Roshon here with us. So I have, just to kind of give you a little bit of a heads up, I have gone through the questions that we've received already via email. And as Chuck mentioned, we're focusing specifically today on events and event organizers and where we can assist there. So some of the questions I have filtered out and we will be addressing on Thursday in the follow-up webinar with Dr. Roshon. So there were a lot of questions around group rides in particular. That's a topic that we'll touch on Thursday. There's also a number of questions that were asked that are actually answered in those documents that Chuck has just presented. So some of them I'm skipping over because you will get that information in those documents when you access those, and I appreciate that that wasn't out already. So the rest of the questions I have included, and I will be pitching those to Dr. Roshon and Dr. Finnof. And then if you have additional questions that you want to send to us live, I'm following the emails, and you'll also be able to do that through the chat that will go directly through me. So I'm just going to very quickly introduce Dr. Finnof and Dr. Roshon. Dr. Finnof is the Chief Medical Officer for the USOPC, and so we're grateful to have him on this call with us today. He was instrumental in helping kind of create the initial framework of some of these documents, pulling together the guidelines from the CDC and WHO. And then Dr. Roshon, as most of you are familiar with now, we have recently appointed as our Chief Medical Officer at USA Cycling. He's been incredibly instrumental in everything that we've been able to provide over this time. And so we're very thankful to have him as well. So I'm gonna let them go ahead and do a little bit of an update on kind of the current status of COVID in relation to events, and then I will start sharing out the questions to them. So over to you, Dr. Roshon and Finnof.
Excellent. Thanks, Kelsey. And thanks everyone for joining us today. I certainly don't want to start with a lecture about coronaviruses. So what I thought we would do is start with a couple of key principles about how this virus works and how that might affect bike racing and bike riding in general and the events that you guys are trying to put on. Some of these are debatable. We are in the very early phases of this. And so we certainly don't have all of the answers, but I think that these are general principles that we can discuss. And so what I thought I'd do is just go through these, get some comments from Dr. Finnof, find out the places that we fully agree and maybe where we disagree a little bit, just given the nature of this pandemic, and then we'll open it up to questions. First of all, I want to start by saying in bike riding and bike racing, we're very used to the concept that there's no such thing as no risk. Anything that you do is going to have some risk associated with it. And now we have the regular risks of bike riding and bike racing. And on top of that, layered over that is the risk of this pandemic. There's nothing that you and I or anyone can do to put somebody at no risk for this virus if they're going to go outside into the world. So that is just the way it is. But let's talk about 4 key principles. Number one is this virus, the SARS-CoV-2 virus, is very easily spread. We see that. You've seen it in the news every single day. The main reason for that is that there's almost no immunity to this in our population. This is a brand new virus. Nobody has seen it before. So the susceptibility of our population is near 100%. That's going to slowly go down, but that's one of the reasons that it's easily spread. However, it's also relatively easily controlled. This virus, as you've seen, the things that we've done, some social distancing, hand washing, mask wearing, closing down high-risk areas, it really has done a lot to control the spread of this virus. So that is very, very encouraging. Basically, I would put this virus on a easily spread and easily controlled spectrum as very similar to influenza, which is a relatively easily spread virus, but this is nowhere near as bad as some very common viruses that we're all used to. If you look at how fast measles is spread, or even chickenpox, if this virus was as transmissible as either one of those viruses, we would not be talking about having bike races. We probably wouldn't even be talking about riding our bikes outside. This virus is much more easily controlled because of the nature of the virus and how it's spread. Dr. Finnof, do you agree with that? Dr. Finnof, you might be muted, but all right.
Unmuted, but he was having some issues, so you might have to wait on it.
I'm going to take that as complete agreement from Dr. Finnof. And so I'll go on to the next principle, which is this virus is primarily spread through direct contacts with other people that have the virus and the droplets from those people. That is really key when you talk about how do we plan to mitigate the risks of being out in the world, whether that's on a bike or anywhere else, and dealing with this virus. There are some concerns about aerosolized spread. We know that while that may be a possibility, and there are some examples where it looks like it was spread aerosolized sort of through the air, that is very, very rare, and it is certainly not the majority of the way this is spread. So in closed spaces, aerosolized spread seems to be happening in poorly understood ways. We think it is real, but clearly the most important thing is direct contact and droplets. And that's important because, once again, we have things we can do to help mitigate the risk of that. If this was spread all through the air, like say a measles virus or a chickenpox, again, we wouldn't be having this conversation. So that brings us to the next principle that I want everyone to consider whenever you're either going to an event or putting one on. I think that on-bike outdoor activities are probably the lower risk of infection from whatever event you're going to. On the bike, out in the world, with the whole atmosphere to spread it to, in the UV light, that is a lower risk of infection. And in fact, there's lots and lots of studies coming out now really getting at that in cases where known sick people were exposed to other people outdoors, the risk of spread is very, very low. So what that means is you have to pay at least as much attention to the off-bike activities. How did you get to the event? Where are you staying? Where are you eating? Where are you around other people? If we do perfectly in the on-bike activities and then do poorly on the off-bike activities, you're going to see transmission of this virus. So we've got to pay attention to both of those. Dr. Finnof, I see you nodding your head. You agree?
Yeah. Can you hear me okay now?
Loud and clear.
Excellent. Well, that's actually an emphasis on the World Health Organization. So when they talk about hosting mass participation events and or even just an event where a lot of people go and attend, a lot of it has to do with logistics of going to and from the event. And so I think that your emphasis on being careful on who you're traveling in the car with, where you're staying, what equipment you're using, and so on is just imperative. Excellent.
I'll get us to our last principle for how we put on events and how we handle this, and that is people have two primary responsibilities, and this is for all of us. This goes when you're going to the grocery store versus going to a cycling event. You have the responsibility to not spread the virus if you have it, and you have the responsibility to not contract the virus. And those are two different things you're going to do to mitigate those risks. Let me just give you an example. You might wear a mask thinking that that's going to keep you from getting the virus. When you're going to the grocery store, when you're going to Costco or whatever, when you're going out for a bike ride, you might wear a mask. That's awesome. It does have some effect on keeping you from getting the virus. But in fact, the biggest part of that is that if you have a mask on, and you've touched some droplets, you have the virus on your hands, it's hard to touch your face if you've got a mask on. The mask protects you mostly by keeping you from touching your face. The real thing that the mask does is it keeps you from spreading the virus. If you're in that asymptomatic phase where you may have been exposed to the virus a few days ago, now you're shedding virus, but you don't even know it. And we know that happens for a day or so in many folks that get COVID-19. So you're shedding the virus, you don't know it. If you have a mask, you're reducing the droplet spread from when you cough or sneeze or even speak by over 99%. So you have the responsibility to not get the virus yourself, and you also have the responsibility to not shed the virus. How that affects how you act when you're on the bike has some pretty significant implications. If you are in the front of a pace line you need to sneeze or cough, you need to get out of that pace line. And so we need to make sure that the folks participating in these events basically understand those responsibilities and accept them. Those are my 4 principles. The virus is easily spread, but it's easily controlled. It's spread through droplet contact, through direct contact and droplets, and that when you're on the bike outdoors, you may actually have a lower risk, but it's the off-bike activities that contribute to the transmission at any event. And then we need to all embrace the responsibility to not spread the virus and to not contract it. I'll take any comments, Dr. Finnof, on those, and then I figure we'll open it up for questions from Kelsey.
I think those are great points, and we'll just move right into the questions. Thanks.
Excellent.
Awesome. Thank you so much. So I'm going to go ahead and start with kind of some of these we've answered in webinars previously, but I think it's helpful to touch on it because the questions have come through again. So it's been pointed out that there's been some conflicting messaging around how COVID is spread, and in particular around which droplets can and can't and spread it and from what distance. So could you touch on that, please?
Yes. I think it's great to ask these questions over and over again because we get new information all the time. One of the things that happened is early on in this pandemic, there was a paper that came out. There was an experimental paper that looked at the survival of the virus in aerosolized containers and also on surfaces. I think it's really key to point out that was an experiment. That was not dealing with patients. It was a very unusual experiment that really doesn't track well with what we see happens in the real world. Since then, so that was early March. Since then, we've had a lot of experience in healthcare settings and other settings with how this virus gets transmitted. And I could go through a list of case after case after case of people that were in close contact, healthcare workers, in a room with somebody who was on a ventilator, didn't know that they had COVID for days and days and days. And with simple hand washing, not even being very careful about masks and gowns and all of that kind of stuff, the transmission was incredibly low. Furthermore, we've done tests with actual patients, having them cough. That in this case I'm thinking about right now, they collected air samples 10 centimeters, so about 4 inches from the mouth of a patient, coughing and talking, and they tried to collect air samples and they could not find virus in that case. So look, we know that there are cases of aerosolized spread. We know that they happen. It's just that they seem to be very, very rare. If they happened all the time, we would see a very different spreading pattern. I don't know how to tell you how to know when those are going to happen. Once again, we're back to there's no such thing as no risk. I'll tell you that I walk into the hospital basically every single day, and if this was spread as simply as measles or chickenpox, I would have had it 100 times over, and I haven't. And we've seen that very clearly in transmission to healthcare workers, people that are exposed to people. Again, it's easily transmitted, but it's also relatively easily controlled.
So I'll make a few comments on that. So the difference between aerosolized and particulate transfer is just the size of the particle that's in the air. And based on that size, if it's very small, it floats in the air for a long time. And if it's bigger, it drops to the ground relatively quickly. And that's sort of the basis of this 6-foot distance. And one of the big things with cycling, and something you need to take into consideration, and even running, is that a 6-foot distance in terms of physical or social distancing is based on just normal resting respiration and no movement. So if you're moving and you're running behind somebody or you're riding behind somebody and they breathe, you move right into that area where they just breathed, and particularly if they cough or sneeze, as was mentioned earlier by Michael. And so just realize that your rate of movement should change the distance that you're behind somebody, or change your position. So for instance, there have been some recommendations about extending how far you are behind somebody. One of the other things is just ride 6 feet to the side of them, and then the particulate matter goes behind them, and it doesn't come across to you unless you have a wicked crosswind. But that's one of the reasons that it's going to be much easier to run a time trial than it is to run it in pack. And while there haven't been a lot of studies that have looked at outdoor transmission, and it very likely has a much lower risk, heavy, vigorous breathing around people, and particularly when you're in tight quarters, which can happen in a pack, definitely has transmission risk. And I'll just give you a quick example. In a choir practice of a fairly large group, one person had COVID-19, and after a single practice, nearly 50% of the participants ended up testing positive for COVID-19. And so if you are breathing hard, you're around people consistently for a prolonged period of time, that is an issue. That's obviously a different thing than a bike race. But if you're in a pack and you're going along, it's not windy, and you guys are talking and coughing and spitting and all sorts of stuff for a long time, and you're next to a person who's sick, I mean, that increases your risk of being sick. And so just make sure that you do try to maintain some distance. That's the primary way of preventing infection spread.
Wholeheartedly agree.
Okay, next question. This one's come up quite a few times, but kind of essentially, and maybe not a straightforward question to answer, but what's the difference between risking going out to a grocery store or any other place and wearing a mask or not wearing a mask versus doing that within the cycling context? Why would cycling be more risky than any other environment, potentially?
Jonathan, you want to take that one?
Sure. I mean, essentially every single thing that we do in daily life, the more that we're around people, and particularly if they are ill, and if you're in a community that has a fairly high prevalence of COVID-19, there's risk associated with it. And that goes for biking, that goes for going to the grocery store. The higher the risk in your area, the more you need to stay away from public settings. And that's why essentially in most places where there's a lot of people getting sick, the hospital resources are getting overwhelmed, they essentially say not only shelter in place, but only go out for emergencies. If you don't need to go to the grocery store, if you don't need to go out and be around people, then you stay indoors. In many of the areas of Europe where it was a really bad outbreak, they were ticketing people if they were outdoors and didn't have a note specifically saying why they were going outdoors for an activity. So, you know, is cycling worse than going to the grocery store? No. If there's a high prevalence, then you have to worry about it, whether you're cycling or going to the grocery store. But all the stuff that Michael talked about, you know, wearing facial protectant, making sure that you have physical distancing, washing your hands, not touching your face, those are the things that you do, whether you're going out in the community or you're going out on a bike ride. And as we have lower and lower numbers of people in the community that actually have the illness, you have lower and lower likelihood of coming across somebody who is sick, and therefore your risk is lower. So, you know, really pay attention to your local community. Try not to do a lot of sharing between communities until we have lower risk. Flying is a big issue right now, just strictly because you're getting mixed with people, even though I think the airlines and the airport industry as a whole is doing a nice job with it. You just, you know, stay in your local community. When you go out riding, try to maintain some social distancing. If it's a really high risk in your area, ride alone. Michael?
Yeah, I agree with all of that. I'll just offer two observations. Number one is clearly the thing that matters is how many people are you exposed to and how close and how long. And so that's the thing. When you go to the grocery store, there have been, hundreds and hundreds of people in there that day. I think probably going to the grocery store, by yourself is much more dangerous than going for a bike ride by yourself, clearly. The question is, now, would I go to the grocery store with 20 of my closest friends in a pace line all packed in close to each other? I'm not going to do that. So that's the issue with biking, is how many people are that you don't know, that you don't have control over, and you can't control your actual distance from them. That's where the risk comes from. I will say that one of the amazing stories of this, my hospital, we have 5,000 employees, doctors, nurses. We've had 3 cases of COVID-19 in the hospital. All 3 of them were from the community. And we know clearly that they were contracted from the community. Now, there may have been others that were mildly symptomatic and never even got tested. We may never know exactly how many cases there were, but those are the 3 positive tests that we've had. And when you look at large cities like Mass General in Boston, when they look at their healthcare workers that became infected, it didn't matter where they worked in the hospital or the fact that they worked in the hospital. The one thing that correlated with who got infected was where do they live. So the people that lived in a city or a suburb of Boston that had a high infection rate were much more likely to be infected. That tells you that they're getting the virus from the community. They're not getting it from the hospital. And why is that? Is it because there's more sick people in the grocery store than in the hospital? No, that's not it. The sick people are definitely in the hospital. It's that in the hospital, we're doing everything we can to mitigate it. We're doing the careful hand washing. There's a hand washing station every 5 feet. People are wearing masks, and people are paying attention to that. So the risk is there, but the risk is mitigated. And the question is, can we do that in cycling and in events?
It's interesting that you bring that up. We've only had 3 athletes in the Olympic training centers, the 3 Olympic training centers, that got sick, and all 3 of them, it was because they went out and did a community activity. So, if you have a controlled environment and you're doing a good job with hand washing and cleaning surfaces and so on, you really can mitigate risk pretty dramatically.
Microsoft has a showcase page for Microsoft 365.
I think we've got someone that needs to mute. If everyone could just make sure they're muted. Thank you. So another question, we've only got about 10 minutes left. And so I'm going to we've got a couple questions to go through. One of the questions that multiple people has asked is, should they be riding with masks on? So if we're thinking about having events come back, should the riders be wearing masks? And are there any concerns around, someone that might have a compromised immune system, as in like mild asthma or something, and the idea of wearing a mask? Is that potentially more risky than beneficial? Maybe one of you can answer that question if you're able.
I'm happy to say, so, if you're immunocompromised and you have a significant risk factor, then you just need to be very, very careful with putting yourself in a situation that would expose yourself to getting sick, because the last thing you need is to have a bad outcome. And by bad outcome, it's either death or serious morbidity associated with this, where you have a lot of problems going forward. As far as wearing a mask, if you're in a group right now, it is not a bad thing to wear a mask. That's really gonna, as Michael pointed out, it really reduces your risk of spreading droplets to your fellow riders. It doesn't necessarily protect you from them, but it protects them from you. So if everybody is doing that in group rides, that's probably a really good thing right now. And as far as it putting a stress on your respiratory rate, it's not fun to breathe in a mask. But asthmatics have been doing this for years as far as reducing pollen, and also in winter sports to keep your air warm and humidified. And I mean, elite Olympic athletes have done this for a long time. It does not cause people to have hypoxia where they don't have enough oxygen and pass out and stuff. So it is absolutely doable, and something that you can compete at a very high level wearing a mask.
I completely agree. Do not go out for a bike ride in a well-fitting N95 mask. You do not want to do that, right? But a standard cloth mask or just a regular surgical mask is going to be fine. What I would say 2 things. So if I'm out for a ride by myself, I don't feel that I need to wear a mask. If I'm with people that I don't know, or if I'm on a crowded trail, I'm going to wear a mask. And I think what you need to do is pay attention to your local rules and the local culture. I mean, the last thing we need is a bunch of bad press about, rude cyclists that are riding in large packs without masks when everybody else in your community is wearing masks. So, when in Rome, do as the Romans. I think that's probably being a good ambassador for our sport and also makes sense. And the other thing I would suggest is bring a spare. If you're going for a long ride with some buddies and you want to wear a mask, it's so easy just to tuck an extra one of those cloth masks in your jersey pocket, and because they can get quite sweaty and unpleasant. Trust me.
All right, awesome. So I'm going to touch on a couple things and go to the next question. A number of people have commented about the fact that the UCI put out some guidelines and recommendations today. How does that compare to ours? What are we going to do with it? We will touch back on that. I would say on the Thursday call, we can mention that because obviously that just came out today. Another question was, how does our policy compare, or this is not a policy, sorry, let me take that back. Recommendations and suggestions compared to the USOPC ones. As I mentioned, Dr. Finnof provided us with his resources very early on, and so these are very much comparable. It's obviously been tailored to cycling, and there's some differences in the fact that the USOPC documents, there's some of the comments that I'm seeing are specific to how they're dealing with it at the training centers. So ours will be different because we're not operating training centers necessarily, or at least that's not what these documents are for. So just to kind of answer that question to a bunch of people at once.
Hey, Kelsey, can I just say one thing about that?
Yes, please.
I took that document and the risk management tool, that spreadsheet. That's about 5 or 6 pages with a lot of questions on there. I took it to our local health department and went through it line by line, and they loved it. They said somebody who showed up with this level of preparation and understanding of the risks and how to mitigate it is much more likely to get their event approved. When you look at that spreadsheet, it's going to be a little bit intimidating just because it has a lot of details on there, but it really is meant to guide you through what are the people who are going to be permitting this, what are they looking for? And if you do that, you're going to, and you can come up with a good answer, you're going to sail through their thing once things open up a little bit.
Awesome. Thank you. Kind of comment to both of you, Dr. Finnof and Roshon, is can you please share, and you can share it with me, the evidence that you're referring to in some of these research studies, and then we'll be able to add those to our website so people can kind of get an idea of where this information is. And then question was around thermometers, this idea of touchless thermometers. What are your thoughts on, is that a potential option for event organizers in future?
We're in our document, we recommend that people, and frankly, at the training centers and any events that we are hosting, we're going to make sure that we check temperatures. There are ways people get around temperatures, just like anything else. But that being said, it's an objective measure, and if you ask people and they're sincere with you and answer their questions, do you have a cough, shortness of breath, and do you have a temperature, and you have a thermal scanner there, that's a very nice objective measure, and you can do those in mass screening. And so if you're doing oral thermometers, very slow. You do a thermal camera, it's pretty fast.
I agree. The problem with temperatures is people can get around it, and also biology can get around it. So there are people who begin to shed the virus before they get a temperature. The question is, we're trying to find that as soon as we can. And sometimes people will begin to see a rise in their temperature before they really notice it. So those thermal scanners make it way faster and way easier, and they can be quite accurate. If you're having a small event and you don't have a thermal scanner, or a thermal touchless thermometer, then you can use a regular one. It works just as well. It's just going to be a little bit slower.
Awesome. Are there any recommendations about specific types of thermometers that could be used or should be used?
And we're looking at a whole bunch of them, but I don't have a specific brand that I would recommend per se.
Yeah, I agree. I think the touchless ones are going to be way better if you're starting from scratch. That's the one I would try to get. Just understand that yeah, it's a combination of the temperature, the questions, and people's symptoms and how they're feeling. Nothing's going to be perfect for sure.
Awesome. Well, I think we're going to go ahead and wrap up the questions, the Q&A now. Thank you so much, Dr. Roshon and Dr. Finnof, for being here and for all the support you have been and continue to provide us. I really appreciate it. You guys have been instrumental, and so we're so thankful for your involvement and your time. For those that have asked questions that potentially haven't been answered, as a reminder, I will be addressing more of these on Thursday. And also, if there's anything that you think about later and want to ask, you can email us at Event Services. So I'm going to go ahead and thank you, Dr. Roshon and Dr. Finnof, and then I'm going to hand it over to Chuck to close us out.
Our pleasure.
Thanks, guys.
Great. Thanks a lot, Kelsey. And doctors, thank you so much. I just can't reiterate how lucky we are to have both of you and the advice you've given all of us over the last few weeks. I've been answering some chat during this time, as has Kelsey and Tara. And the question came up of does this mean we're not having mass start racing? And in some areas, yes. And that's not us. That's not the organizer. In a lot of cases, this is going to be local governments and policies in place. I think we all see the social distancing requirements in a lot of states. The return to riding and racing document, we actually go through some case studies in regards to 4 or 5 states and what's in place there. So this isn't necessarily something we are going to be doing with mass start events. It's going to be what coronavirus and COVID are doing to mass start events. That said, we're very much looking forward. I think if we all look to what happened just 4, 5, 6 weeks ago as compared to where we are today in society, things have pretty radically changed. And our hope, again, is that we are moving for the better. There's some good news today about a possible vaccine for later in the year. We're not going to pin our hopes on that completely. And also just how we can still have some type of events and do it safely in the coming months, if it doesn't mean regular mass start racing that a lot of us are used to and love. So again, you have our assurances that we will keep moving on this. We're finally at a point we think we've got some good guidance and ways to move forward, and we're going to keep doing that. I will say one more time that the chats that you all have asked, we're sorry if we didn't get to them, either whether they're on the chat function or email, and we're going to work over the coming week to get those consolidated down and provide some answers. So we very much appreciate the feedback. On the screen there, you'll see the email for our event services department. If you're an organizer and you need some help with a permit or your event, please feel free to reach out to us and we will get back to you. We're going to close it for today right on time at 1 hour, and really appreciate the support you all showed for the sport by jumping on the chat today and the concerns you have. It only makes us all better. So with that, we're going to end things and hopefully look forward to seeing you out in events in the near future. Thanks.